board. So we are recording. So just a reminder to be careful about your protected health information that you're sharing. Excuse me one second, my dog is barking. I am so sorry. He doesn't have anything to say until I'm busy. So use the chat for us, please. I have Sam Hall here from my team, and she is monitoring the chat for us. And as well as we will provide the slides with active links out after the meeting. I'll put those in the meeting notes, as well as put them into our shared drive so folks can have access to that afterwards. If you're listening by phone, welcome. If you'd like to unmute yourself, you can hit *6 to unmute your line and *9 to raise your hand. So I'll be monitoring that. Closed captioning is available. Down at the bottom, you'll see your black ticker, I guess, and you can activate closed captioning or live transcript for yourself. So that's been turned on. And then any information about this meeting, any recording and meeting information can be found on our Direct Care Workforce Collaborative website after the meeting. So that's just some basic housekeeping. I see 14 participants in the chat, so I'm going to wait to run our polls until a little closer to 1:30, so our presenters can have an idea of the makeup of the group and let folks trickle in. But if you wouldn't mind putting your name, an agency, and your role at that agency in the chat, that'll give at least the people that are here an idea of who is here, and we can wait for the participant to tick up a little bit before we do the polls. With that, I'd like to hand it over to your co-chairs to do a quick introduction and take us through the agenda.
Okay, I guess I'll go first. I am Deborah Lively. I'm Director of Public Policy and Public Affairs for Leading Age Colorado. I am one of your co-chairs. And Leading Age Colorado, we're a statewide organization. We represent the continuum of senior living and care providers across the state of Colorado.
Hey everyone, I am the other co-chair. My name is Andrea Kuwick. I'm a senior policy analyst at the Bell Policy Center. We're a statewide policy advocacy research organization, and just thank you all so much for being here today. We're really excited for the conversation. And I'm going to hand it back over to Deborah, who I think is going to go through the agenda.
I am. Okay, so yes, thank you all for being here today. As Brooke said, we've got a pretty full agenda. We're going to start with, Brooke is just going to talk to us a little bit about some ARPA work funds or ARPA workforce compensation research, the mouthful, and give us an update on that, and also talk about in January how we're going to have some opportunity for feedback on that. The bulk of our meeting today is going to be spent on the CLIF tool, which is a tool developed by the Federal Reserve Bank of Atlanta, really to help workers get information on how their benefits change as their income increases. And then we're going to have announcements and resources, announcements from you all, anything that you would like to share with the group, and then some additional ARPA updates, and then talk about our meeting coming up in January. So Brooke, I'm going to turn it back over to you for our ARPA update.
Absolutely. Thank you both. All right. So you all may have remembered us we talk about all of our ARPA projects all the time. ARPA is American Rescue Plan Act, and that is the funding that has come to us after the pandemic to help us push a lot of these ideas forward. A lot of these ideas came to fruition through these action groups and through the collaborative, and we've been lucky enough to have this money now that we can take these ideas and really start pushing them forward. So one of those was workforce compensation research. And so that is really Government Performance Solutions is our vendor, and GPS is really looking to scan the United States and say, hey, what are people doing in different areas? What's working, what's not working, and what can we potentially implement here in Colorado with the successes other places are seeing? And so what GPS is doing is they're working with us, the department, to develop recommendations for innovative and impactful practices to support our direct care workforce. And they're also doing some work with our case management workforce too, because we're finding that a lot of things we're doing for the direct care workforce might also help our case managers as well. So GPS will be coming to visit our action group in January for stakeholder engagement and feedback, and just to kind of set the table a little bit. They'll do a presentation in December on all of their findings to date. Right now, they are working with individual states to provide or complete interviews with those states about what they're doing with their direct care workforce and what is working and what's not working. So they're working with state partners. I believe Washington, I think they're looking at Nevada, a few of the states that tend to do a lot of the same stuff we do and are demographically familiar, but then also they're doing some states that are very different from us too. So they'll be able to tell you which states they're actually using, but they're doing state interviews right now to learn what people are doing. And so that December at our big collaborative, they'll present those findings. And then what they want to do with January with our compensation and benefits action group is really dig into those strategies more and say, how can we really implement these in Colorado? What have we tried before? Does anybody know of ways this might work? And so they're really using us kind of as their jumping off point to get some feedback on what they found, but also start implementing things into action for us. So this is a terrible slide. I just pulled it from their presentation they did for us. But we know that Colorado is a leader in this area already. And so what you'll see in the blue column is what Colorado's already doing. Those are our ARPA projects. Those are things that you as the collaborative and the action group said, these are important to us. Let's push these forward with this money that we have. And so you'll see the increasing payments to providers and workers. We had that wage pass through at the beginning of the year for $15 an hour minimum wage for folks. And we're continuing. We know that that is great. We know that's not enough. So we're going to continue to push that as well. Enhancing the direct care workforce data infrastructure. We are finding, as we're trying to push these things out, that there is not a lot of data. We know that direct care workers are kind of hard to pin down. You know, there's not a database of direct care workers that we can go and push out information and learn about them. And so we're really trying to get a baseline of information and data that we can use to push these ideas forward. If you're in the Training and Career Advancement Action Group, you know that we're working with University of Colorado, Colorado Springs on a standardized core curriculum that will be available and free to folks to take. So if you're working in Grand Junction, Colorado, and you complete the standardized core curriculum, but you want to move to Fort Collins, you can go to your Fort Collins employer and say, hey, I have these basics. I have this core knowledge of what a direct care worker does. So let me get the specifics of this agency and this partnership, and then I can move forward, hoping to cut down on training time. Resource and Job Hub, that's where that core curriculum will be housed. We're kind of hoping like Indeed for employers and employees to be able to connect with each other. Creating a training fund, allowing providers and individuals to apply for money to really push that training forward, supplement what you're already doing, and release some of that training burden. Sam is here working on career pathways. So direct care workers can see themselves in the healthcare field or other fields as nonlinear career pathways. And so they can see, this is where I start, these are my transferable skills, and I can stay in this field and grow, or I can find ways to help in other ways. And then finally, rolling out the public awareness campaign. So those are the ARPA projects that we're doing. I see that Sam has put that link in the chat for you to overview those. But if you're in any of our action groups or the collaborative quarterly, you're hearing about those things. So what has GPS found that we're not doing yet that might work? Well, they looked into a couple states and found that states are using peer mentoring as that mentorship or relationship to help new direct care workers kind of navigate the waters. Peer mentoring can reduce turnover rates, increase competency and job growth, as well as job satisfaction, so you're not feeling alone. One option they're suggesting for Colorado is state of Colorado could offer a workshop or series, technical assistance, to establish peer mentorship programs. Is that going to work? We don't know, but we want to put it out there as an option that people in other states are doing. Let me go to the next slide here. Workforce housing. One thing that they found that's already happening in Colorado is the Colorado Department of Transportation is working with local governments and agencies to find housing for critical drivers. So that's your snowplow drivers, that's your, roadway care workers. I don't know what that's called, but providing housing for those folks as a benefit, and also to get those individuals into the areas that are hard to live and work in. And so those are the rural areas. Those are the mountain towns that are expensive for folks to live in. And so CDOT is doing this. This is something that they're engaged in and they're doing. And so learning from them, you're already in Colorado, you're already doing it. Is this something we can mirror in the direct care workforce? And then finally, it looks like we have tiered compensation. And so that's pay based on your skills and your experience. This can solve turnover problems, feeling stuck in your career. We're doing a little bit of this looking at in career pathways and standardized core curriculum with stacked credentials and micro credentials and things. But this just gives it a little more time and space. Tiered pay tied to experience, skills, and competency. So it doesn't have to be you took this course and you earned this badge. You've been in the field for 15 years. Maybe that is how you are being compensated. Health insurance and other benefits, paid time off, transportation, childcare. We've asked them specifically to look at childcare and how people are solving the childcare and elder care, if that's a benefit that they're finding a way around in other states, and also assistive technology. So these are some things they're looking at. It's not everything, but these were the ones that kind of stood out initially as they started this research and shared with us. And so we certainly want to keep these in mind when they're coming to us in December and in January. Do you know of something like this that we've tried before and it just failed? Is that something you can share with us? And so what they've done is they've prepped us with some questions. And these you can provide feedback in the chat. You can provide feedback to me. I'll have maybe Sam put my email address in the chat for us. As you're thinking of these, or you can just bring the answers to these questions to either the collaborative in December or the action group meeting in January. So of the items above, or the ones that we talked about, the peer mentoring, the tiered compensation, and the housing, which one do you think would be the most impactful and why? Which ones feel feasible to us? Are there existing models in Colorado that we should be looking at? Or if you're coming from Wyoming and you know that they've tried something and we should be looking at that, let us know that too. You're the experts in this field, and we can do the research, but the personal knowledge of how this works and what this does at a local level is really important to us as well. Potential barriers. Of the items that we've talked about, what concerns do you have? Can you think immediately of barriers that exist that would prevent implementation? Like, that's just not going to work. Like, oof. Do you have knowledge of any of these ideas being tried now or in the past and they failed? And what lessons were learned? If you have any information. If you don't, that's okay too. Sometimes examples of like, oh, I know they tried that in Aspen 3 years ago. That's beneficial to us. We can look into that and see why. So that's just a quick overview of what GPS is doing for us, and how they want y'all to be involved, really providing feedback on the barriers and feasibility. Looks like Jenny has shared in the mountain resort towns. I know they've offered pre-selected housing plans plus $20,000 bonus for nurses. They didn't receive any applicants. Part of any effort for these more remote exclusive corners of our state, we may want to consider how the recruitment efforts connects to the benefit package. Absolutely, Jenny, absolutely. So anything you drop in the chat today, anything you email me, will be shared with our vendor, will be shared with GPS for their consideration. And they're really open to feedback. And they're at a point now where if they're receiving feedback, they can really dig into it more and bring back answers for us. So what I'd like to do now is just give you all a little bit of time to chew on that. We have about 14 minutes before our presenters will be ready. I see 19 folks on the chat, or on the call. I think I'll go ahead and do polls for us so we can get an idea of who's here and the makeup of the group, and then I'll check in with our presenters and see how we're doing on time. So if you will bear with me while I pull up these polls. The first one is going to be about which region you represent here in Colorado. So just take a peek at that for me. And I'll be sure to share these results too. Got about 50%. I'll give it just another minute here. All right. I'm going to go ahead and end the poll and share the results. As traditional, we have a lot of representation from our first region and the Front Range Boulder area. Or excuse me, we have some representation in our Boulder area as well. Alamosa, Baca, Bent Chaffee, couple people there, and then our statewide partners as well. And so we are still trying to do outreach in those areas that we're missing, Cheyenne, El Paso, Elbert, Kit Carson, and then of course the Western Slope, and then our Southwest corner as well. So if you know folks in those areas who you think might be interested, be sure to share what we're doing here at the Compensation and Benefits Action Group. So let me stop sharing that and I'll go ahead and launch the second poll. This is how you identify on the direct care continuum. So this just gives us an idea of who's here in terms of what your role is and how you're connected. I have about 60%, so I'll give just a few more, like 30 seconds. Not sure what I do with my screen there, but hopefully you can see the agenda back up. Let me share the results here on how you identify on the direct care continuum. So we do have a direct care worker here with us, a couple employers, some advocates and the advocacy agencies, government agency, and then other, which we're asking you to specify in the chat if you wouldn't mind, but certainly just happy to have you here. Let me launch our final poll. And this one is just how are you hearing about us? A lot of folks were learning hear about us from John Barry's newsletter. So we like to provide good feedback to John if that's the case, or if your employer is sending you or whatever. I'll give folks about a minute here. All right, looks like we have a good representation. So I'm going to go ahead and end the poll here and share the results. Again, your employers are sending you those advocacy agencies. We love those. And then, yeah, John with his HCPF newsletter communication. We love that. So thank you all for answering those. That gives us an idea of who's here, where we can continue our outreach efforts. And then our presenters have an idea of who their audience is as well. All right. I'm going to stop sharing the results there. And I'm chatting with Susan. It looks like Susan is ready to go. She might have to wait a few minutes for John, but Susan, I'm going to quit sharing and let you get set up.
Thanks very much, Brooke. I appreciate it. And thanks to you all for having us here today. I just want to say that just moments ago, I had the hiccups and I think they're gone. But if something embarrassing happens, let's just laugh and move on. Okay, so before we get started, I have a question for you and you could enter in the chat. I don't have a poll set up, Brooke is very tech savvy. I'm wondering about how many of you know what the cliff effect is and what a benefits cliff is. Is that something that is familiar to you all?
No, never heard.
Just trying to gauge the level. If you know something about Cliff, you could enter in the chat that you've heard of it, but we are kind of starting at square one so that everybody can follow along and be on the same page. I'm Susan Paulson. I am the digital tools consultant for Colorado Workforce Development Council. And what that means is I look at different tools that we can use to support and grow our workforce. One of the main tools that I oversee is My Colorado Journey. Hopefully you all have heard of that, but if not, check it out. The tool we're going to talk about today, which is the Cliff dashboard, is available from the tools menu on My Colorado Journey. Just a tidbit there. And it's a very specific tool. And what we've done in Colorado is partner with the Federal Reserve. They have been building this tool to help people understand how changing jobs or trying to move up in a pathway might affect the public assistance they receive. And at what point is that a good choice? Or, you know, what we really want people to know is the information. If you do this, this is what the financial situation would look like. And John can talk more about that in a minute. I want to thank him. Last minute, I asked him to join us. John Reese is with the Federal Reserve in Atlanta, and he is very knowledgeable about these things. This tool has been developed over the past year and was piloted in northwestern Colorado, Pueblo, and Arapahoe Douglas Works did a pilot for it. So now we're ready to kind of get more people on board, let everyone know the tool is available. I am available to either answer questions for you, not just today, but anytime, or send you to the person that can answer your questions. So we are all learning this together, and I would just like to see if John's available to get started. And John, I'm happy to run the slideshow.
Perfect. Can everybody hear me all right?
Yes.
All right. So I have the slide deck as well, so you can either transfer present to me or just bring it up on your computer, and we'll go from there.
I'll just bring it up on mine.
Perfect. Well, thank you, Susan, for the introduction. My name is John Reese. I'm a senior policy advisor with the Atlanta Fed, specifically working in the Advancing Careers for Low-Income Families initiative. And our big focus is on barriers to economic mobility. And specifically, at the moment, we are focused on the benefits cliff issue. You can go to the next slide.
Oh, so you already know who we are, but just in case you didn't, there's our lovely.
In case you forgot.
Headshots.
And so, yeah, I presented, I think it was at the statewide workforce conference last month. And as Susan explained, we've had several pilots in Colorado. This is a nationwide initiative. And our purpose is twofold. One is to identify these benefits cliff, conduct research on how to address these, and create tools to help illustrate why this is, I think, an important issue, particularly in an era of where workforce is really, you know, there's a labor crunch pretty much everywhere. And then engaging in partnerships such as these, where we're trying to identify partners to help us deploy these tools and to work with us to make them better, right? We have spent the last couple of years developing these tools, which I'll show you in a little bit, but they are by no means sort of final, and we're constantly working with partners to improve them. It sounded like from the introduction that some people have some familiarity with this issue, some do not. Fundamentally, a cliff effect happens when there is a when you take on additional hours or take on a raise, and that puts you just above the threshold for a public benefit. And so you may actually be worse off for taking that extra hour, taking that wage increase. And so it can be a real disincentive for career advancement, because although you can be worse off in the short term, generally speaking, you are better in the long term, but it can be very difficult to navigate those cliffs in the short term. And so again, we've developed some tools to help give people a better understanding of where those cliffs may be. We've worked with some policymakers to look into ways about changing policy to address these cliffs. In other instances, we've worked with nonprofits to figure out, are there ways that we can deploy additional wraparound services to mitigate the cliff? And in other circumstances, we've worked with employers to see if we can identify career paths that help people sort of navigate the benefits cliff, so that, all right, maybe you're worse off for 6 months to a year, but eventually you're going to get to a position in which you're fundamentally better off. Again, this may seem like a pretty niche issue, but I think you're going to see, as I can show you in a moment, how widespread this issue is. It impacts not only workers, but employers and the government alike. You go to the next slide. For workers, this is a survey we conducted in Alabama, where we'd asked workers if they had delayed or declined taking a new job or promotion because they were afraid of losing some form of government assistance. And about 37%, 38% of workers said they had, which is not an insignificant number, particularly when you're dealing with 3, 4, maybe 5% unemployment in some of these regions. Every little bit helps, right? And if we can move the needle on that, I think it will benefit not only employers, but also workers, right? Because again, generally speaking, with the long enough horizon, the worker is better off taking that promotion, but there can be a really disincentive in the short term. Sort of the flip side to this worker question, we actually asked employers in Florida, had they experienced workers turning down jobs or promotions because of the fear benefits cliff? Pretty similar figure. Again, about 1 in 3 employers saying that they had workers turn down hours or advancement because of this fear of losing government benefits. I think one thing our tool also does is that, one of the things we've found in some of our research, workers don't always know where these benefits cliffs are, right? And so they may actually be fine to take that additional hour or that advancement, but because they don't know where that threshold is, they often consider it just safer to say no, particularly since, right, let's say you take on that additional shift this month, you lose your benefits, but then that shift goes away, right? And it's a lot harder to get those benefits back as it is to lose them. And then finally, the impact on governments. This is some of the modeling we've done over, I was presenting in Vail, so I pulled an example from Eagle County. If a worker transitions from a minimum wage job to an LPN over the lifetime of their career, just from a state and federal perspective, there would be anticipated to deliver $300,000 in additional tax payments versus the alternative. So again, addressing this issue, I think, really does provide an opportunity to empower workers, to benefit employers, and benefit governments as well. So in support of the benefits cliff, we can go through the slides and just let's go to the dashboard tool. Or actually, let's go to the one before that shows the 3 tools. Go 2 more slides, I think. I apologize. It's been a while since I looked at this exact one. Yes, so there are 4 primary tools that we've developed to help illustrate the cliff effect. I'm going to spend most of my time today talking about the dashboard, which allows the user to model basically the lifetime financial impacts of making a career change. It's a pretty nice balance between giving a comprehensive view of a employee situation without requiring a whole lot of information from the client. We also have a cliff snapshot, which is a very simple point in time that if you take this job, if you take these additional hours here, or we calculate is the immediate change in your financial situation. The Cliff Planner allows us to take a longer term view and get really detailed into the individual's financial situation to make it extremely customized to an individual situation. One of the benefits of that approach is increased accuracy, but it also takes a lot longer to complete. So again, and you'll see it today, the dashboard is kind of a nice sort of Goldilocks in the middle type of approach. We also have a Cliff Employer Edition. If an employer is thinking about, let's say, promoting or offering a salary increase to a worker, they can kind of run through that scenario and see if it's actually going to make the worker better off financially. It also allows them to play around with some potential other fringe benefits that sometimes may be excluded from tax considerations. And so let's say by either providing healthcare insurance or maybe a commuter transit pass, you might be able to give that worker sort of increased material resources without giving them a raise and without tripping up that benefits cliff. But for today, I want to spend the next 5 or 10 minutes going through an example with the Cliff dashboard, which again, I think provides a pretty nice introduction to our suite of tools.
John, do you want me to go right into this slide? Or do you want to do a demo?
Oh, I was going to do, is the demo not on? Did it get stripped from the presentation? I had a demo previously in there.
Okay, so let's see. It might be further. So these slides, oh, you're not seeing, hold on, let me go. I got a couple of screens going.
Yeah, let's pass the snapshot and pass the dashboard. So yeah, this is perfect. Can you expand your screen to take the?
Well, wouldn't that be something? Sorry, I can't see.
No, it was fine with the introduction slides, but now it's a little hard to read. Can everybody see this okay?
Oops.
That was fine.
Okay. Are we good?
Perfect. I can see it. Let me go.
Yeah, I think we're good.
Perfect. Okay, so yeah, this is the Cliff dashboard, and it's really going to ask you sort of information in 2 or 3 primary buckets. One is your geography, one is your household composition. The third bucket of information we ask for is any kind of public assistance you might be receiving. And the fourth is, at least for the dashboard, what your target occupation is. The reason we start off with these geographic components is, one, obviously where you live is going to determine what public benefits, what level of public benefits you get, right? Because they all, and what are the rules governing those eligibility requirements? They differ in each state. We also calculate an overall cost of living for an individual, incorporating local information on things like housing, childcare, and whatnot. And so again, we ask that geographic information of the users so that we can use locally estimated information about their living situation. The second thing we're going to ask about is your household composition, because again, a lot of the benefits potentially you may receive via public assistance are really going to ultimately depend on the household composition, right? Do you have children? If so, how much they are, or how old they are, because that's also going to determine things like childcare, not only cost, but eligibility for services. And then again, the dashboard what sort of conceptually is helping people consider, all right, I'm in a current role, I'm thinking about switching to another role. Does this make sense? And so the last bucket of information down in that bottom left asks about the targeting occupation, where an individual can select what they're considering. In this example, we're saying LPN, and it'll ask you what type of training is required. If you know it, or you have a local partner that you work with that, let's say, has an accelerated program, you can select that. For today, we're just going to say to use the nationwide average about training. So in this example, it's going to take a year to get the requisite credentials. And then you can compare this occupation to any other occupation, or for today's purposes, we're going to say a near minimum wage job, which again, for today's purposes, is just going to be a cashier. And a lot of the financials will be dictated by the local community that we've selected, which again, was given us originally in Eagle County, or today also it's in Eagle County. Once you click all that information, it's going to generate a series of charts. The first one is going to show sort of take-home pay in what we call our self-sufficiency target. And that maroon color is the take-home pay for that LPN, right? And that sort of marigold bar is that near minimum wage job as a cashier. And as you can see, that first year, actually, you're worse off pursuing that LPN because we assume while you're in school, you can only work half-time and you're working in a near minimum wage job like a cashier, sort of on the side. But after that first year, you see a pretty substantial increase in take-home pay, right? That take-home pay reaches around $40,000, where it was under $25,000 as that near minimum wage job. That gray dotted line is our calculation of what it would take to be self-sufficient with the household characteristics that you've provided, right? And for this example, you got a kid. So even once you get to that 40,000, you don't have enough money from what we estimate would be your cost once you account for housing, for childcare, for utilities, for food, for healthcare, and all those. And so I think this is what we've historically often seen, right, as the sort of career choices of like, all right, yeah, maybe it's difficult in that first year while you're going to school, but after that, it's a pretty significant payoff financially to getting that LPN degree, and you see this in the take-home pay. What those traditional measures do not include, however, are public benefits. And once you incorporate that information, you get a very different picture potentially. You can go to the next slide. And by incorporating those public benefits, we at the Federal Reserve try to calculate an individual household's available net financial resources, which includes not just the income from your job, but any public assistance that you might receive, less expenses and less taxes. And hopefully this provides a much more holistic approach to sort of household financial situation. You can go to the next slide. And once you incorporate that, you can sort of see, one, these are the public benefits. You see this on the left is that LPN, on the right, that near minimum wage job. Again, remember, in our LPN scenario, you're going to school that first year, you're working part-time, making relatively little money. So you qualify for a lot, but that public benefits drops off pretty precipitously once you graduate from school and you're making more money. Whereas if you're in that near minimum wage job, you get a not insignificant amount of public assistance for at least 10, 12 years. It really only drops off when your children are actually aging out of the household and you're no longer receiving that public assistance. And so again, we take this information, we basically add it on to that take-home pay information that we saw in that first chart, which will lead us to the next slide, which is your net financial resources. And so again, that sort of dark red is the LPN and the marigold is the near minimum wage job. And so the picture gets a lot more complicated here, right? Is that you are better off as that LPN, but it's not twice as better off, right? In that first chart, you were making almost twice the amount of money. And there's a not insignificant benefits cliff in that third year, where as your wage goes up, you're losing even more money in public benefits. And so you basically hit a break-even point in 2023 compared to your self-sufficiency. That dotted line is the measure of self-sufficiency. You basically hit that your first year in 2023 after you've completed schooling, but then you're worse off in 2024, and you really are just treading water for the next 5 or 6 years. You don't really start coming ahead. It's honestly until one of the children you have sort of ages out of needing child care, and so you lose that expense and you start making real progress. Again, I think this hopefully helps visualize why this is a big issue and why obviously we want to promote career advancement. As you can see, sort of long term, once you get to that sort of far right, 2040, right, you are significantly better off in that LPN position, but it does take a long time to get there, and you're probably going to need additional assistance during that period. So again, this is the CLIF dashboard. Once you hit that, you enter all the information. This is all on one screen. It's a little easier to read, but I like to do it with this just because I can go over each slide individually, and also having done this a decent amount of times, I never know if things might crash if we're doing it in a live setting. But again, hopefully this provides a nice introduction to not only the issue, but some of the tools. We again have several other tools. I'm happy to set up a demonstration for any of those if anybody is interested, whether it's the planner, the calculator, or the employer tool. So yeah.
So does anyone have any questions, or would you like me to go back to a certain slide to just clarify what you've seen before I stop sharing?
I'm not seeing anything come through the chat, and I don't see any hands raised. So
Okay, I'm going to go ahead and stop the share so that we can all see one another again. And that, oh, I do see something come up in the chat here. How does this plan accommodate unexpected expenses?
So as I said earlier, this tool incorporates a lot of sort of federally available data. We've kind of created a household budget for things like housing and childcare. And for simplicity's sake, it sort of drives itself and doesn't really account much for unexpected expenses. With that said, we have other tools that would allow you to do that. The planner, for example, would sort of say, all right, how are we going to navigate this next couple of years? Let's build out a specific budget to allow you to do that, where you could sort of say, all right, we're going to anticipate that we have, $100 a month in unexpected expenses to allow you to get a little bit more granular. Like I said, the sort of trade-off is that it just like takes more time to calculate.
This is Scott Fast. I'll just put it in a plug for this because I like the fact that there's two tools here, meaning that there is the one that can give you that high level flyover, and you can change if you wanted to move on to registered nurse, right? You could then compare that. Well, I'd get the LPN, and then if it's going to be worthwhile for me to keep going up to registered nurse or to move over to sonographer or something like that instead of LPN, right? And it does a lot of really of that great modeling that helps the families understand it. And then once they kind of get hooked on that, they can go into, what's the other tool, John? That's the lower level one.
There's the snapshot, the dashboard, and the planner.
So the planner then allows them to do some of that modeling, like what you were indicating. I want to start to understand what happens if I change houses, or I start to save to buy a house, or if I, just iterations of what's going to happen as my life changes as I grow older.
And we have the planners, or I'm sorry, the calculator is sort of important time, which is even, if someone's in crisis, right, they don't have the luxury of thinking, all right, what career am I going to pursue? What are the long-term trade-offs involved in that? We're trying to stabilize them. And that tool sort of allows them to say, all right, if you take this out, here's immediately what the impact might be. But we're not going to overwhelm them. It's just not often where they are. So our hope is that there's sort of this, survive to thrive continuum where there's different points in an individual situation in which they can leverage different tools.
And John, can you talk about the employer tool? Does it have similar information, or what is included in that tool?
Yes, it does. It's a little simpler. It's actually, in some ways, almost a mirror image of that snapshot where it says, if I do this, what happens? We're still sort of figuring out the best way to deploy that for a couple reasons. One is, and we're piloting this with a couple employers, we're trying to figure out if the employer is actually the best person or best entity to deploy the tool, right? Because a worker may not be extremely excited about telling their employer about what public benefits are on. I've heard kind of different things on that, and so that's something we're trying to figure out. And the second thing, which is a little complicated for us at the Fed, is that we're not tax lawyers. And so it's our understanding, right, that say that like a fringe benefit, like a transit pass generally is not taxable. And so if you gave someone that, let's say you're working in a place like Denver where that's worth several $100s a month potentially, that may actually be more of a benefit than giving a worker a dollar raise. But we can't say that with any certainty because it's just, we're not tax attorneys. But it can give you a nice sense of, I'm working with, interestingly, several caregiver co-ops who are trying to get an understanding of, they've often advocated for increased wages. And the employer tool might be able to help them understand, well, you're advocating for that, but like half of your workers aren't going to be better off because of that, because they're going to hit these cliffs, or maybe not, right? That's the other thing, is that I do think it's a little, I do think workers tend to overestimate or underestimate how much they can make. And so this can sort of say, like, you should be fine, right? And again, I do want to emphasize, these are not strictly eligibility tools. They're sort of a screener. You'd have to then go talk to the appropriate agency. But the employer tool I think it could also help employers understand that, just adding additional, there's so many employers that are having such difficulty recruiting right now, particularly in a lot of the lower skill, lower wage, let's say service occupations. It's important for them to understand that simply raising wages may not necessarily make their position more attractive to people. And this can help them sort of model that. So I would say that of all the tools, that's the one that's sort of the earliest stages. Like, the tool is fully built, but we're trying to figure out the best way to deploy it. Does it work for small businesses, or like we're piloting right now with the OARD healthcare system? Or does that work better? Because not only do you get scale, but in a healthcare setting, there's just a lot more career pathways, right? In which we could say, all right, well, yes, you're going to hit this cliff now, but if you get that LPN, but if you get that RN degree, and you're going to be much better off, and there'll be no cliff to worry about. So again, but if you know of any employers that are interested, please reach out, because we're trying to figure out how we're going to engage employers more aggressively in 2023.
Another plug I'll put in is for those of you who work statewide, the expenses change by county. Is that right, John? If I remember right,
Yep.
it's calculating it by county. You'll find a much different scenario for a person making $15 in Alamosa or in Fort Morgan. Then you'll find someone earning $15 an hour in Vail. It actually is a strong incentive to attract people into the direct care workforce in these small, in the communities where there's lower cost of living, because they can, the numbers are better than what John showed there, because that's a high expense area. It's also a high expense area in the Front Range as well, right? So the numbers don't look more like what John was showing, but it can be a great attractor into the industry, that if you get this job, you'll be okay financially at direct care, and then you'll be great financially if you move up to LPN or RN.
Mm-hmm.
Just a little bit of background on this group for you, Susan and John. So we did a poll over the last couple months at our action group meetings, and the benefits cliff was actually something that this group is really interested in learning more about, and maybe finding ways to push it out to our local direct care workers and local areas. And so I guess maybe by a show of hands of the group here, it sounds like, John, you're able to go into more depth with the planner and a few of these other tools, and just to see if maybe there's an interest in having him come back and take us through the more detailed views and stuff, as well as we learn more about this. Or just a yes in the chat if you're interested, that kind of thing. And it does look like Susan put both John and her email address in the chat for us as well. And it looks like that would be, so John, maybe you and I can circle back around after this meeting and just kind of talk about what that might look like for your schedule and things, and you and Susan. But I think there's an interest here with this group, and certainly learning more and finding out the best ways to make this accessible to our rural areas and then our direct care workers as well.
Absolutely.
Does anybody have any final questions for John while we have him here today? I know this is a lot of information to absorb, so that's why I put his email in the chat. But yeah, before we wrap up and let you guys finish your meeting, now's your chance to ask John any burning questions.
That's absolutely right, Scott. I'm saying a lot of people would be better just to get comprehensive benefits than a wage increase, which you can see in some of our modeling. Well, thank you so much. Like I said, I'm more than happy to give another demo on some of our other tools, whether it's with this group or if any of you want to set up something for your own organization or your own local partners. We do try to partner with local organizations that can help. I will say, and I should probably make this clear, we have not really designed our tools just to send out to individuals. We try to have them be deployed in a coaching setting. And so, you know, but if you know of local partners, we are open to bringing on more partners throughout Colorado and the country at large. So again, happy to keep engaging with you all, either collectively or individually. But thank you very much for your time.
Thank you, John. Really appreciate your time today. Appreciate it.
Yeah, have a great weekend.
You too.
Bye, everybody.
Thanks, Susan. Thanks, John.
Thank you, Susan.
You bet.
All right. So I think all that's left is I just had a few resources and announcements. So while I'm pulling the slide back up, if any of you all have announcements going on in your agencies, things that are coming up, resources you want to share, I would love to give you the floor for a few minutes. So just chime in chat or go ahead and come off mute and let us know what's going on. All right, well, I'm going to get this pulled back up real fast. Switch that over. All right, so announcements from attendees. Doesn't sound like anybody has anything, but if you want to drop something in the chat with something that's going on or a resource you'd like to share, happy to do that. And then I can push it out to the group if that comes through chat in the notes as well. So I'm going to have Sam share some links for us just to keep an eye on the ARPA projects website, as well as the ARPA grants website. That is constantly being updated with the grant opportunities that are available for application. That's where you'll find our training fund grant, where providers can apply for expenses to help reimburse training costs. And we'll also open that up to individuals, I believe around the first of the year, for individual training fund grants as well. And then there's our Direct Care Workforce Collaborative website with past recordings of our Direct Care Workforce. I'm going to put this recording on the website. So if you have folks that weren't able to make it that you think would be interested in the Cliff Tool presentation, we'll have that posted to our website along with the notes. And I think I'll ask Susan and John to maybe send me the slides as well. So that's something I can push out to you all. And then just a reminder that our next big collaborative, our quarterly collaborative, is December 14th at 10 a.m. And our next compensation and benefits action group meeting will be January 20th. Happy New Year. And we will welcome GPS with those questions. Hopefully to come and engage the group and get some feedback on what they found and what you would like to provide. I know a couple folks put messages in the chat about some feedback for them that I'll make sure to pass along. Deborah, Andrea, anything for us in our last few minutes?
I don't have anything, but thank you all just so much for being here and really appreciate it. That was a great presentation.
Perfect.
I do not have anything else either.
Okay, perfect. That sounds good. Well, I will keep in touch with Susan and John. I think our January agenda is probably quite full with GPS, but if there's time then for them to come back, otherwise we'll look at inviting them back next spring to do just a deeper dive into the benefits cliff and really how we can, maybe our advocacy agencies or our employers or something can start using that and helping our direct care workers make informed decisions. So thank you all very much. Look for notes later this afternoon and we appreciate you. Thank you.
Thank you all. Have a great weekend.
Thanks, you too.
Thank you all.
Thanks, y'all. Thanks, Brooke.
Thanks, Pascal. See you soon.